Hi everyone, welcome to ManpreetRN Talks. I am Manpreet, a registered nurse, and here on this channel we make nursing concepts simple from NCLEX prep to OSCE tips, hospital instruments, and clinical skills. So, if you are a nursing student or preparing for exam, so this is the right place to be. Your shortcut to NCLEX success. So in this video, I will cover ABG compensation. So ABGs can feel so hard to understand, especially this part. So what does it means when the body is uncompensated or what is partially compensated and how do you know if it is fully compensated? So don't worry, today we will break into a super simple lines. First is uncompensated. So it means the body has a problem, acid base imbalance, but hasn't started fixing it yet. So, for example, means the imbalance is new or sudden, so the opposite system hasn't had time to react. For example, in this, PS is usually abnormal. Only one system, either lungs or a kidney, is abnormal, and the other system will be normal. It is that is still sleeping. So, for example, a patient coming in the OPD with sudden opioid overdose means if there is respiratory acidosis. So, in this, the kidney haven't started compensating yet. So, only lungs they are involved, but the kidney they haven't started compensating yet this problem. So, it means that is uncompensated. So, pH usually abnormal means it is acidosis or alkalosis, and other system, either lung or kidney, will be abnormal. So, and the one system will be normal. So, you can understand it. Next is partially compensated. Partially, as the word is suggests, partially means still partial. So, the body knows there is a problem and it is trying to fix it, but hasn't fully succeeded. Means the problem that is that is not fully succeed. So still there is a problem, and the body is trying to compensate either kidney or lungs. Both they are involved in injuries. So in this pH that is still abnormal, and both kidney and the lungs they are also abnormal. They are always trying to compensate the problem. So means the lungs and the kidney they are actively trying to balance the pH, but it takes time. For example, a patient come in the OPD or in the emergency early stage of a DKA treatment. So in these lungs they are blowing off CO2 in like pulmonary breathing, and the but pH is still acidic. So you can remember pH still is abnormal, both PaCO2 and bicarb they are abnormal. So all the three things they are abnormal in this. So the second system is working, but pH is not come back to normal. So next is fully compensated, means the body has successfully fixed the pH even though both system look normal. So in this pH is normal, fully, but it may leading either acidic or alkaline. So both PaCO2 and bicarb that is abnormal and balance is restored. It means the opposite organ has adapted over time. So patient looks stable even though lab values looks off. For example, in chronic COPD, CO2 is always high, but kidney raise bicarb enough to normalize the pH. So simple way to remember for the NCLEX. So think of pH. So if there is uncompensated means one side is down or other side is not helping. In the partially compensated, the other side is pushing up, but the balance hasn't resorted yet. And the fully compensated, both sides they are adjusting and they are trying to compensate the problem. So now you know how to break down ABGs uncompensated, partially or fully compensated. So it's all about pH balance. So keep practice and soon this will feel automatic. So thanks for watching Manpreet RM Talks. Typing you learn smart and pass easy. See you in the next video.